What are the advantage of dental implants?
So advantage of the dental implants is we can help, using the dental implants to as a anchor. So on top, we can help to restore the missing tooth. It's much more comfortable and the chewing efficiency will be much more improved.
What is the process I will go through if I decide to get dental implants?
First of all, we will do a comprehensive oral examination to see if you are a good candidate for dental implant.
What is involved in the dental exam?
First of all, we will check the medical condition. For example, if you have a high blood pressure, diabetic, smoking, if you have those medical conditions which are not under control, we would not recommend dental implants until those medical conditions are under control. Second, we will check in your mouth if you have a decay or active gum disease or like a clenching grinding habit. If you do have those disease, we need to get infection or inflammation under control before we provide the dental implants. The third one, we will check the missing tooth area or the unrestored tooth structure. We will make a detailed treatment plan before we do the implant placement surgery.
Why is my medical history important?
Yes, implant therapy is based on the implant like grow well or also integrated with bone well. However, if you have some medical condition, for example, uncontrolled diabetic or like heavy smoking, those can cause inflammation of your gum or bone, which cause more bone loss. And in the long term, the implant may get biological complication, for example, the bone loss around the implant. Eventually, you will get a failing implant.
How will my dentist come up with a treatment plan that is right for me?
Yes, based on the comprehensive oral examination, the doctor will normally give you a couple options. We will choose a best option for you to benefit from the smell well and function well, and it has a long-term predictable outcome.
What are the steps in the process of placing a dental implant?
So first of all, we will do extraction of the tooth. Second, after tooth extraction, we will do bone graft to make the site like a very suitable or with a certain nice sufficient bone volume to hold the implant. Second, we will place implant surgery. Afterwards, 3 months later, the implant will also integrate it with the bone so that we can make the crown or bridge or overdenture on top of that implant.
When would bone grafting be required?
The bone graft is required when the site, missing tooth site, there is not sufficient bone in terms of the height or width to hold the implant. In this time, we needed to do the bone graft to build up the nice bone volume so that we can place the implant, then to get the solid foundation for the implant.